welcome
Yeah.
Professor Peter Hollands for this podcast. This is a podcast where we try to demystify whether the regenerative medicine is in hope or in hype, or else we also try to even demystify what's the pros and the cons of this technology and also the myths. Because his book,
Mm.
The Regeneration, promises the fallacies in which the regenerative medicine and its technology has given out should have need to be demystified. Thus, I have an expert here named Professor
Mm.
Peter Hollands, who is who's helping me demystify what's that technology all about. I welcome you to this podcast, sir.
Thank you, Vishwas. That's a very remarkable introduction.
Yeah, sir. Let's just start with a question,
Yeah.
sir. There is a lot of hype which this stem cell technology has actually given. Tissue engineering has also given the same kind of an
Mm.
hope to the people who might be suffering from some other the diseases. What is
Yes.
disease all about to you? Because you are a clinical and a clinical scientist who is just working on the technology, but yet there is a lot of things which you have come across. What's disease all about to you?
Yes, it's a complex area, really. Regenerative medicine started many years ago with the first bone marrow transplant, 1956, in fact. So it's important to understand, first of all, that stem cell technology is nothing new. We've been doing this for many years, but we've not been calling it regenerative medicine when we started doing it. So all of the stem cell transplants for leukemia and blood disorders, using initially bone marrow, but then more commonly using peripheral blood stem cells, which are stem cells brought out of the bone marrow, and also cord blood stem cells. They're all hemopoietic, which is a horrible word, but it just means blood forming. So these stem cells can make blood. Um, and so this was the basis of regenerative medicine, and that's where we started. And my PhD at Cambridge was actually on hemopoietic stem cells. So I was sort of joining the gang. But ever since, there's been considerable development over the years, and we've seen the discovery of many different stem cell types. We found them in cord blood, which is probably the first one that we found following bone marrow. But now we're finding stem cells in almost every organ in the body. And it's quite extraordinary the amount of progress that we've made. But most of this progress is in the laboratory. So we're getting some fantastic lab data, and we're getting some brilliant publications, but we're not properly translating that to the clinic. And that's where the problem lies, because if you don't translate the stuff from the laboratory to the clinic, then there are people out there who will just pick up on the idea and do it anyway. In countries perhaps where there's low regulation or poor regulation, and they will offer it to vulnerable patients. And there we have a major problem, because the vulnerable patients have usually been through some horrible disease. They've had all the traditional therapies, which unfortunately have not helped. And then their desperation, they are then looking for further help. And this is understandable, and this is the human way. And I fully understand that. But they are incredibly vulnerable to these people who want to sell them untested, unproven treatments. So that's the problem, really, and that's the premise behind the Regeneration Promise, my new book, where I try to explain all of this to the general reader, because the general reader is the person who's actually making the decisions nowadays. They're contacting these stem cell clinics, and the clinics are saying, yeah, we can treat diabetes. Come to our clinic, give us $20,000 and you'll be fine. And of course, that person's taken in by that. They think that the clinic has got healthcare professionals. They think that they're operating ethically, but they're not. And this person spends all that money, receives what is effectively a useless treatment, and then goes home and finds there's no benefit whatsoever. So we're in a strange situation, and sessions like this will help people to try to understand about what's happening and what dangers they're in.
So, this is an brief description of what disease is all about from you. But
Yeah.
there is an hope which technology has already given.
Mm.
Can this really solve a non solvable problem that is being experienced by the people today? It can be anything like Alzheimer's, it can be anything like
Mm.
neurodegenerative diseases. There are a lot
Yeah.
of things where this is considered to be an hope.
Yes. Yeah.
What's your thoughts on this hope that we are actually going through?
I think we all have to have hope. We all hope about things in our lives and in our activities. I hope my research works, but it doesn't always. And that's the problem. We have a situation where I often talk about hope and hype, those two together, because the hope side is very important, and it is the basis of all the research that I do and my colleagues do, that we're hoping that we can come across a system which we can translate to the clinic and make it a great success. And you're absolutely right. We're all aging longer or living longer. We're all likely or possibly to develop some sort of neurodegenerative disease in the future. And I'm thinking not only Alzheimer's, but Parkinson's and MS and all the rest. And there is fantastic work going on in stem cell technology in those areas. My own research on stem cells called very small embryonic-like stem cells is showing great potential in neurodegenerative disease. And so, but the hype comes when people pick up on these ideas. They read a paper in a journal. They probably don't even understand what the paper's saying, but they see they perhaps see the title, potential cure for Alzheimer's or whatever, and they pick that up and run, and they take it to a clinic and invent a treatment, and hey presto, we're in the situation that we're in. So it's a very complex area, really. But yeah, we've got to have hope, and we don't want hype.
Yeah, I just wanted to ask you this one question where, on the scale of 1 to 100, how much is our understanding behind the physiology of the diseases and about our understanding on how influential stem cell technology is all about today?
That's a brilliant question, actually, because we pretend that we understand things, but in actual fact, we don't understand the fine detail. We don't really understand the true structure and function of a cell at the moment. We know what it looks like, but we don't really understand in detail what goes on inside. So we are at the stage where we are coming to new frontiers. Some of the work that I'm doing is looking at the interaction of a modulated laser with living cells, with stem cells. And this is cutting edge stuff. It's we've just published our first paper, and we're invoking things like quantum physics in the explanation of these interactions of lasers with cells. And this is where we're going in the next phase of understanding, but we're not there yet. I mean, in basic physiology and disease, I would say we're very high on the scale, because we've got good understanding. And the recent COVID pandemic, the scientific progress on that has been absolutely extraordinary. And the way in which that we've understood it, we've understood the virus, we've developed a vaccine, we're starting to get it into people. And that shows the power of science. Without that science, the whole world would be in a big mess now. But then we have to get the things to be suitable on the stem cell side. We have to get everything suitable to be used clinically. And that's a massive process. We have to go through clinical trial. Clinical trial has 4 phases. It usually takes best part of 5 years to get through to the point where you can actually use it on people. And then that's where we are in the actual treatments. So the application of the actual treatments were pretty low on the scale, apart from bone marrow. And bone marrow is a fantastic thing, and it's been used absolutely beautifully over the years for blood disorders. And it's also used now to treat some patients who suffer from multiple sclerosis. So a bone marrow transplant is used to effectively reboot their immune system. And when that is done, patients find remission from multiple sclerosis in some cases. So this is a great thing, and it just shows the potential, especially on the neurodegenerative side. But we've also got, we've got heart disease, where my own research has also got some great data. And we've got lots of other things. Diabetes is a terrible disease globally, and we need treatments for that. And there are stem cell treatments in the pipeline, but they're in the research phase, not in the clinical phase.
Yes, there is a lot of influential thoughts which every paper, books, or every scientist, even in his little talk, gives
Yeah,
about the stem cell technology. There is a huge hype about how tissue engineering can actually be developed. But what
mm,
has made all these technologies that influential, just like how deep learning has to the present world today? There is a
yeah,
lot of influence that is gone in terms of the scientific era, which medicine has never seen.
yeah.
Regenerative medicine has brought that. What's that actual influence that actually got this technology to?
Um, yeah, I mean, it's been a big process. We have technology such as induced pluripotent stem cells now, and these can form things called organoids. And organoids are effectively little collections of cells which represent an organ. So you might have an organoid for the heart, and it represents heart cells, or a nerve, or a kidney, or whatever. And that's a very interesting model because it potentially gives us a model to better understand organ function in vitro in the laboratory. So that's good. I mean, some people also say IPS are suitable for, potentially suitable for clinical treatment. I worry a little bit about that because when we make IPS, we actually introduce new genes into the cell. So we take a standard cell, say a skin cell or a blood cell, and we inject or we introduce new genes into that cell, and it turns them into a pluripotent stem cell. Now that's fine. Experimentally, that's fantastic. But clinically, it's a bit of a worry because if you use them clinically, you'd be putting genetically modified cells into patients, and the safety risks there are quite high. So I would worry about iPSCs for clinical use. And also, it's the same thing with embryonic stem cells. There was a massive hype about those back in the 1990s. They were discovered, and everybody said it's going to cure everything in the universe and we'll all be wonderful. And nothing's happened, really. There are various reasons for that. Embryonic stem cells have many, many technical problems. They're technically very difficult to make. In theory, they could form tumours in the recipients. We don't know anything about that at the moment. But most importantly, there are not enough human embryos available to create the human embryonic stem cells that we'd need if we could treat everything. So it's a self-limiting technology, really, that no one's really explained. It's all in the book. Because I worked with, I was supervised by Professor Sir Bob Edwards in Cambridge University, and Bob was the guy that invented IVF with Patrick Steptoe. So from early in my career, I've been working both in IVF and stem cell technology, and we knew full well there were embryonic stem cells in embryos. It's just obvious that they're in there. But we also knew that to use them practically would be virtually impossible. And that's been shown over the years now. I think we've got, I may be wrong, but I think we've got one clinical trial using embryonic stem cells, and that's to repair retina. Now, if that works, that's absolutely brilliant. It would save a lot of suffering and everything, but I don't think they're there for the routine applications. There's just not the availability of the cells. So yeah, we've got that, and then we've got all the other stem cell types, mesenchymal stem cells from fat. We've got mesenchymal stem cells turning up in other tissues, even inside teeth. You can find them. But it's all experimental just now, and it's important to control the enthusiasm of some people who really want to take these things and run, and now's not the time. Give us another 20 years and perhaps.
Yeah, I know. There has been a misunderstanding which has led stem cell from the misunderstanding of what the general public is, from the media people, from the
Yeah,
politicians, because there is a lot of speculations here and there that there is a lot of influence of politics inside
yeah,
this technology also. And
absolutely.
I just want you to just tell these people or answer to those questions which these people have imposed on this technology. Like,
Yeah,
I just want you to ask, why are they so adamant on just giving our body that potential of just healing by itself? Our body know how to break bones, and it also knows how to repair it. And
yeah, yeah.
also, with lot of usual complications that we go through, how is
Mm.
that misunderstanding leading to an adversary in this research?
Mm. Yeah, yeah, it's extraordinary, really. We have a situation where there are people who are making key decisions about stem cell technology that really don't understand um, what they're making the decision on, and this is not their fault. They may be getting poor advice. They may be getting biased advice, even. If they're talking to companies who have a vested interest in a stem cell product, they may be getting very biased advice disguised as scientific advice. That's a very easy thing to do. It's happened many times over the years where scientists have either fabricated data or even fabricated theories to fit their data. And it's a great problem that we have in science. Science isn't perfect, and everything that we do does not necessarily work. I think that's what people need to understand. I've already mentioned the COVID thing, and we've done some astonishing things there. And that then gives the feeling that science can do anything. And really it can't. We're still learning, and we still need tons of research so that we can progress safely. But you're absolutely right. All the decision makers and everything, they would be well advised to read my book as the first as the first step. Not because I want to sell the book, but because it contains some basic information which they would all benefit from. Politicians, the media in particular, the media get very excited about stem cells every now and again. And it's usually when some very vague story about embryonic stem cells comes out. And the reason for that, I think, is that they can show a very nice picture of a human embryo, and it all looks terribly exciting and interesting. And if I then tell them about a discovery I've made in very small embryonic-like stem cells, which are tiny little things in our circulation, in our blood, they look very boring. They're not very interesting to look at, and they could not put a picture up because there aren't very many pictures of them. and it all becomes a bit esoteric, and they can't really grasp onto the ideas. And this is where a better understanding from the media would come in extremely useful. You know, the media are fantastic people, and I'm not criticizing them in any way, but they're doing their best, but they do need more support, I think, especially in science. I've got some great colleagues in science who interact with the media beautifully, and that's good. But there are other scientists who cannot interact with the media at all. They're very poor at speaking. They cannot get their ideas across. They revert into terminology and horrible stuff that no one can really understand apart from the people that are talking about it. And so that's another problem within science itself, communication. It's been a fact for many years that science communication is poor. Not between scientists, but between scientists and everyone else. We have TV programs with sort of celebrity scientists, but in general terms, the quality of those is quite pathetic. They're more of a light entertainment program than a real informative program. But then we have very good science programs. There's one in the UK called Horizon, which is absolutely excellent. But for that one Horizon program, there are probably 10 others which are just misleading. Perhaps not deliberately misleading, but accidentally misleading. And you know, that's something that the politicians need to look at, the scientists need to work together, and we need to all to come together. I mean, I keep referring to COVID, and it's actually very interesting because the UK government keeps on insisting that every decision they make on COVID is based on the science. So they say everything we do is based on the science. And that sounds fantastic, and the media love that, and they run off and write things saying we're all scientific based. But when you actually look at it, the politicians are considering the science, but their decisions are political. And their decisions are based on things like the economy and things that are not science. So the scientists, we're in a terrible lockdown just now in the UK. The COVID numbers have gone up. We've got a new variant. It's all out of control. And back in September, the scientific committee told the UK government that they need to lock down because this is on its way. And they told them time and time and time again, and they ignored it because of the economy. And so here we are today in a total lockdown with 60 odd thousand cases per day, over 1,000 deaths per day, and they didn't listen to the science. So it's a big problem, and I don't think it'll ever be resolved because politicians have a complex job to do. They can't just base it on science. They've got to base it on what's best for the country. But that may not mean that you save lives in the way that you should. So I've drifted off quite a little bit there, but hopefully it'll be useful.
Yes, it will be more useful because I just wanted to ask you this one question. How much is a blind experimentation that is going on in this technology? Just just to write papers,
Blind,
there are a lot of blind experimentation that everybody can experience. What are your thought process on those blind experimentations which is happening in this technology?
okay. By blind experiments, do you mean using them on patients?
Even by the own patients or else just by giving an ac- accurate result which might be having some sort of adversaries kind of.
Yeah. It's actually totally rampant across the globe. We have stem cell clinics who are offering untested, unproven treatments for considerable amounts of money to highly vulnerable patients, and there is no science or medicine behind the offering that they're giving. It's a shocking situation, and it just worries me that patients are being exploited in this way. It is quite quite harrowing, really, the things that we're going through. But the experiments, I mean, a lot of experiments are actually blind, because you set your hypothesis. So you think, okay, I believe that there are some stem cells in this tissue. Let's design some experiments to find out if that's true. So we say, okay, we think the stem cells in eyes. Let's have a look at eyes and see if we can find some stem cells. So we do our experiments and we find some stem cells, and that's good. That's scientific progress, because we now know the stem cells in eyes. But we can't then make that massive leap and say we can now treat eye disease with stem cells. That's where the problem is, and that's where we are at the moment. And people don't seem to have, well, vulnerable patients who've failed other treatments, it's absolutely understandable that they seek alternatives. But when they seek alternatives, they must enter a safe environment. And at the moment, they don't.
Yeah, there has been, when you told about the failures, I was thinking of this question. There has been a lot of failures which this technology has experienced. There are academic records which come up with these failures. What's your view on those? Any one where you can really specify and say your view on that failure which this technology had, and what has been that influence from that failure on this technology? Because when there is a
Yeah,
launch of a rocket, there is a failure, but it's an value learning. But in the
yeah.
stem cell technology, how is that failure influential?
Yeah. So we've had lots of failures over the years, largely because of sometimes experimental error. There have been ridiculous claims by some scientists about stem cells, which have been subsequently proven to be fake. There was one time there was a lot of fake information coming out of China, for example, and they were claiming that they'd found stem cells here, there, and everywhere, that they'd used them for treatment, and that it was good. And when you actually look more closely at that, it was fake news, as ex-President Trump likes to call it. Um, and that gives a bad reputation to stem cell technology. It reduces the trust in the public about the technology, and it's just very damaging in every way. Science should not be made up or invented, or it should be evidence-based. The thing that we do in science every day is work to the evidence base. So our evidence will be the research of our own teams, of other people, and the ideas of other people and teams, and that's all brought together, and decisions are made on evidence. When I say evidence, that means things that have been proven. So it's things that have been shown to be correct, not maybe correct or could be correct, but are definitely correct. And that's an evidence-based approach. Now, physicians practice on an evidence-based level. So everything that they do, if they give you an aspirin for a headache, that's on the evidence that aspirin has been shown to help with headaches. And that's the way in which we must practice, but this is not the case in private stem cell clinics offering treatments for profit. There is also something called a duty of care. Now, a duty of care is something that all healthcare professionals will understand. And this is very important, because what it means is that we only act in the best interests of the patient. And having a duty of care and acting in the best interest of the patient is the absolute foundation of clinical practice. Now that's great, and the people that work to that system, which are all the physicians, all healthcare professionals across the world, they all understand duty of care. The private stem cell clinics don't even know what duty of care means. They don't care at all. Their only focus is making easy profit. And that's something that we really, as the whole world, not just as countries, as the whole world, we have to react against. How we do that, I'm not sure. I'm trying my best with things like this interview and writing the book, but I'm just one voice in the background. I'm not famous. People might not even listen to me. They might even think I'm telling lies. Especially nowadays, we have a great problem with social media. There's such a lot of nonsense on social media. For example, there are people who say that the vaccine is dangerous, the COVID vaccine is dangerous. The only danger in the COVID vaccine is if you don't take it, you might catch COVID. That's the only danger. It's an astonishing product that we all must take, and that's part of the thing. But the social media thing is very important. I'm fairly active on things like LinkedIn and Facebook and things like that, and I try and talk about stem cells. And on places like Facebook, there are private clinics offering treatments for this, that, and the other, using ridiculous combinations of stem cells or stem cell products. The latest fashion is to use exosomes, which are little tiny particles given out from stem cells and others. And we don't know what they do. They're probably to do with cell communication and cell regulation, but we have no idea really what they do. These places are offering exosome treatments for severe disease. There's no duty of care. There's no evidence base. They've just seen this thing. They thought, oh, we could make a profit on that. And hey presto, it's on their website. And when I speak to people on the social media and say, hey guys, you do realize this is untested and unproven, the response I get is sometimes almost violent. It's abusive. They say that I know nothing. They say that I'm talking nonsense. They say that they're right. And it all becomes very heated. And this is because I'm touching a nerve in that I'm saying that what you're offering for an enormous amount of money is actually pointless. And when I say that, they suddenly think, oh dear, this guy could take away the massive profit that I'm making. And in this way, I get some really strong nonsense on social media. I think they call it trolls, don't they? Trolls or trolls, I don't know. But it's very aggressive and it's very personal. And if I was a sensitive person, I would feel very attacked and abused. I'm pretty tough. I couldn't care less. I know what I'm saying and I know it's the truth. But that kind of thing. So social media is not helping at all in the overall promotion of stem cell technology. And there are people out there who have strong belief in nonsense, a bit like the Trump supporters. They'll almost turn to violence to support their ideas, which is shocking, really.
But
so yeah,
what are there any specific failures that you want to say today, which this technology saw?
Specific failures. I don't think there's any, apart from the stuff that was coming out of China, which you could argue was a failure. There have been actually, there was one study where a very controversial source of stem cells, and something that I am totally against, is the use of stem cells from the human fetus. So this is effectively when abortions are carried out. The human fetus is obviously there and available. And over the years, some people have tried to use human fetal cells as a source of stem cells to treat people. I must emphasize I don't agree with this in any shape or form, either experimentally or clinically. I think it's immoral, and we should not be interfering with aborted fetuses. But things have happened over the years, and I believe there was one team that used aborted fetus brain cells in an attempt to treat Parkinsonism. And they injected cells directly into the brain to try to increase dopamine production, which is what's low in Parkinsonism. And they did find some success initially. Initially, there were some patients who did find that their level of Parkinsonism decreased, and that was good. But as time went on, we discovered that most of the patients who received these cells into the brain consequently developed brain tumours, inoperable brain tumours. So these people died. So I would probably see that as a failure, probably a failure in medical ethics as well as science, because we shouldn't be doing these things. And it's a bit like, it's not the same, but it's a bit like embryonic stem cells. You know, I've been invited to speak at the Vatican twice about stem cell technology. And the reason that the Vatican are interested in stem cell technology is that they do not like embryonic stem cells. And they do not like embryonic stem cells because to create them, you have to kill a human embryo. You have to destroy a human embryo and extract the stem cells. So I've spoken there many times, and also in similar meetings all across the world. And it's always interesting to see the kind of people that are drawn into the stem cell world. So we've got the Pope interested in stem cells. Who'd have thought that? We have other people who are extremely interested, but they're interested largely for their own interests, for their own beliefs. So the Vatican, they are keen on what we call adult stem cells, so stem cells that are taken from adult tissue, and they don't want to look at anything to do with fetal or embryonic. So that gives another problem with embryonic stem cells, really, that we've got these not only scientific objections, but ethical, moral, religious, which are just as strong and just as important. People have all these beliefs and fears, and as scientists, we have to understand that. And some scientists don't. Some scientists just see the science. And I think my upbringing in IVF helped with this, because when IVF was first developed, the resistance from many people was so strong, it was unbelievable. Once again, the Vatican was a player who said it was totally immoral. But there were many others, very vicious politicians, other scientists who felt cheated because we'd invented IVF and they were working on tubal surgery. I shan't mention any names, but it might be fairly obvious who I'm referring to. And the fight there was similar to what I'm seeing now in stem cells. But it's even worse nowadays because of things like social media. The resistance and the people that want to destroy things just because they want to destroy things is quite extraordinary, and something that we need to try to work harder on. But yeah, so that would be probably the failure I'd be thinking of. It's the failure of some technology, but it's also the failure of bringing the subject out properly, discussing it sensibly, and making evidence-based duty care decisions.
Yeah, You have talked a lot about how this technology has seen the failures and how this technology has been an influence. But I want to
Mm.
ask you this one question: how difficult are the problem statement these days in order to just get the solution out, in order to engineer a solution for this problem statements in regenerative medicine?
Yeah. It's a massive thing. So we have to first of all get the experimental data, um, which sometimes is there, sometimes it's not. So we may have to do that. We have to operate within regulations. So every country has regulations on the use of cells. And this is extremely important. In the UK, for example, we have the Human Tissue Authority and the MHRA, the Medicines Regulatory Authority. And they have, or they control the regulation of stem cell technology. And that's really important. And I fully agree with everything that they do. I think regulation is absolutely critical. Countries without regulation are wide open to scientists abusing things. So that's one of the things. But the thing with regulation is that even though it's fantastic, it does slow things down. So the first hurdle to jump is to get your experimental data um, under the appropriate regulations. Once you've got that, you then got to think about how you translate from the laboratory to the clinic. And the way in which this is done in almost all countries is by clinical trial. So we take volunteers, we allocate them either treatment or placebo being a sort of inactive treatment, if you like. And we take these volunteers, who are, by the way, absolutely brilliant. Volunteers in clinical trial are the way in which we progress in medicine. Without those people, we could do as much science as we like, we could do as much clinical preparations as we like, but without those volunteers, we would get nowhere. So the volunteers in the clinical trial receive either the medication or the drug or the cells, and some receive nothing. And if those patients that receive the cells show some sort of benefit, then that's a positive outcome from the clinical trial. And of course, those that receive the placebo or the sham treatment should have no benefit. There is the placebo effect, which is in fact a real thing, and this complicates things a bit because some patients who receive placebo actually some do report benefits. So we have to bear that in mind as well. But in general terms, the placebo group do not show benefits. And so once you've got that, you've then got the premise for a potential treatment, a safe, tested treatment. But then you've got the problem of how you deliver that treatment. Is it affordable for healthcare providers around the world? You know, I do a lot of work with colleagues in India, as you know, and also colleagues in North Africa. And in North Africa, especially, not in India at all, but in North Africa especially, there are considerable financial problems. So if I say I've got a fantastic treatment, it'll treat diabetes overnight, it's all tried and tested, it's £20,000 treatment, that's going to go nowhere in somewhere like North Africa. The Americans and the rest of Asia and Europe might be very interested, but there'd be lots of people that miss out. So we have to think about that as well. Not everyone can afford this. And it should be, I think it should be for the developed countries to subsidize treatments at a government level in third world countries. You know, there's a terrible amount of suffering. The sickle cell in Nigeria is rampant. The suffering is just unbelievable. And those patients could be treated with a bone marrow transplant. But a bone marrow transplant needs dedicated staff, it needs highly specialized environments, it needs brilliant scientists, and all that costs a lot of money. And the infrastructure just simply doesn't exist in places like North Africa. And so the suffering just continues. The same thing's going to happen, I think, with the COVID vaccine, because they simply won't be able to afford it. And it's got to be almost given to them, I think, free of charge, if we're going to have a duty of care for all of our people. This is a global event. Stem cells and COVID is a global event. It's not just for Europe or North America or anywhere else. It's a global event, and we need to bring it safely on a global scale to everyone. And that would be my dying wish. If I leave a legacy of any description, I would like it to be the provision of safe stem cell therapy across the whole of the world and across the whole of the technology. So not just bone marrow, but everything else as well. And a change in, or a recognition of poverty in other countries. It is unbelievable, really, that we're in the 21st century and the level of poverty and suffering is so immense. It's just mind blowing when you look at it properly. And we can all live on a nice little bubble. You know, I live in a beautiful village about 20 miles from Cambridge. I'm in full lockdown for COVID, but I'm not suffering. I'm quite happy. I've got enough to eat. I've got enough to do. I've got enough money. That's not the case across the world. But I'm getting very political now, and the politicians will tell me off, so I better stop there.
Yes, let's just talk about the book which you have given for the world
Oh, yes, yeah.
in order to educate every individual about what this technology is
Yeah,
all about. What
yeah,
is
yeah.
that thing which it is trying to educate everybody? What does your book say to this world?
Yes, yeah. You know, I was a dear friend of, uh, oh God, I've forgotten his name now. Stephen Hawking. I was a dear friend of Stephen Hawking, who was the guy in Cambridge. We used to have lunch together sometimes and talk about stem cells and black holes. And I'd ask him about black holes, and he'd tell me things I didn't really understand. And he'd ask me if stem cells can treat motor neuron disease, because he was in the early stages of that. And I said, well, not really at the moment. So it was all becoming an interesting conversation, and he was an amazing guy. And he wrote uh, a book about his work, A Brief History of Time. And it was written, I would not say not for the general reader, because it was quite complex. But when I read it, it struck me that this is a useful thing to have. Now, Stephen's work was mind-bogglingly complex, and it's not something that everybody can really, even I couldn't understand it. So I'm sure that your average person on the street would have no clue about it whatsoever. But he wrote this book, and it was an incredible bestseller because people wanted to learn, they wanted to understand, and everyone read this book, and it was almost fashionable to read it. People were talking about it, saying, "Have you read it yet? Or you must read this. Very interesting." They didn't necessarily understand it, but it was an attempt to bring science to the general public properly. And that was my model, actually. When I wrote my book, I thought, we've got stem cell technology. No one understands it. It's clear that no one understands it. If you ask someone in the street, what are stem cells? They might say, oh, do they come from embryos? And that's probably it. That's probably all you'll get. You may even get less. You may even get strange things what people make up. And this was the problem, that we have the whole of the world that doesn't understand stem cell technology. but we have people promoting stem cell technology in a complicated and what sounds a convincing way. And the whole thing is just a mess. So the idea of the book was to write something that everyone can understand. Now, when I say that, I do honestly mean that. I've not used any fancy jargon, I've not used any fancy terminology. I've explained everything in common language, and it's very, very clear. And it does not make any fake claims or anything like that. So it runs through the whole thing, really, from the discovery of bone marrow stem cells in 1956, which I mentioned earlier, right the way up to some of the cutting edge stuff, which I'm doing with my colleagues on very latest ideas in quantum medicine, quantum physics, and biology. So it takes you through the whole of that. But most importantly, it's perhaps the most important chapter is the chapter about patients seeking stem cell treatment. And it gives specific advice to patients who are seeking stem cell treatments and who are possibly talking to private clinics. It gives the questions they should ask. It gives the answers that they should hear. And if those things don't happen, or if they're not happy with the answers that they hear, I recommend that they walk away. Now, this is very tough. Remember, these people are probably desperate. They've probably got a diagnosis which is life limiting, and they're likely to try anything. But what I'm asking these people, and it's a very big ask, is to be critical, and to be critical using the information in the book. So, if only one person read this book and decided against a silly treatment in a private clinic somewhere, that I think would be a success, because that would be the triumph of science and of knowledge and of common sense. But it's a very big ask. I'm hoping people read the book. I know it's selling quite well. The publishers tell me that they've got a lot of interest. And of course, nowadays people can download a book straight from Amazon. So, you can go on there, click the button, and it's in front of you immediately. So you don't have to wait for the publisher to get it to you. But that's by the by. So what I'm hoping is that I get sufficient traction, if you like, in the public's imagination to first of all learn about stem cells properly, learn about what they can do, what they can't do, what they definitely can't do, and what they will never do, and also to help those people who want to or seek treatment. And that's probably the most pressing and the most important part, because those people are so vulnerable. Some of them I know for a fact. I know one patient who gave $20,000 to a private clinic. It was his life savings. These are not rich people who go in for these things. There are people who are using their life savings to try and make things better. And this person received no benefit whatsoever from the process that he went through. So that's the kind of thing that I'm trying to highlight, that I'm trying to bring to the general public, and that I'm trying to resolve in a proper, ethical and moral way.
Yes, probably this is going to clear about the book, because probably if the word stem cell is on the title, there are people who think this is not a book for me.
Yeah,
This approach of yours, in order to educate every individual on what this promises can lead to,
yeah,
whether it's in a pro or a con, would actually help them educate in a better fashion. I just
Yes.
want to just ask you this one question where, there are a lot of ways in which diseases have been synthesized from the cells on an in vitro process.
Yeah.
There
Yeah.
are cells which have been cultured, petrified artificially in order to just understand what that physiology is about. I just
Yeah.
want you to give this view on iPSCs were directly differentiated into airway and basal cells, a population of resembling stem cells of airways epithelium. Can just that observation of synthesizing an artificial and a perturbated cell on an in vitro flask can really give us the proper understanding of what this technology is all about, and how can it help us in delivering the right drug to that process.
Yes. Yeah. Yeah, there's some things that stem cells can help with for that. For example, the iPSCs that I've already mentioned, induced pluripotent stem cells, and the organoid work. But you mentioned actually a very interesting point, and that was the production of endothelial cells from stem cells. There was we talked about failures, and I've forgotten about this. There was a case where there was a surgeon who worked in Stockholm at the Karolinska Institute, so probably the most highly regarded scientific institute in the world. I actually disagree with that because I think it's Cambridge, but I'm a little bit biased. But the Karolinska Institute is absolutely fantastic, and of course, it's the home of the Nobel Prize, which my PhD supervisor Bob Edwards received for IVF. It's a place close to my heart and close to the heart of every scientist, I think, at the Karolinska Institute. Anyway, there was this surgeon there who was working on replacement trachea. So this is the windpipe that goes from the mouth to the lungs, the big pipe down the center there. And surgically and clinically, this is a big problem because people who have pathology of the trachea have major problems, and there's not really anything much we can do for them. So this guy came up with the idea that he could take effectively a sort of a plastic tube. It's a bit more clever than that, but basically a plastic tube, and that he could seed stem cells onto that tube, which would grow and cover the tube. And that would then form, the stem cells were taken from the patient themselves, from the bone marrow, I think. And that would then form effectively an artificial trachea that this surgeon could then surgically insert, and hey presto, your patient's better. And then this caused considerable excitement at the time because it was really the first proposed proper successful thing that went on with stem cell technology. And this guy became very famous in a very short time, not surprisingly. And so time went on, and this guy was doing lots and lots of these treatments. But in the end, it turned out that he was finding that the patients did not do well. In fact, most of the patients that he did this procedure on died, and he did not report this in the first instance. And so he was carrying on with this procedure that in the back of his mind, he really knew didn't work. And so that was another massive hit on the reputation of stem cell technology. And I'm sure that the people who are anti-stem cells, and there's perhaps a lot of them out there, know this story very well. And it was shocking. It was this guy was totally discredited in the end. He was dismissed from the Karolinska Institute. I imagine he was taken off the medical register. But a complete mess, really, based in the home of science, which is just not good. But on the other stuff, yeah, we've got the organoids. We've also got people who are talking about making human eggs and human sperm from stem cells, and then bringing those two together to make a human embryo, and then putting that in a woman to make a baby. This scares me a lot. It's something that I understand it, but I really can't see that we should be interfering with human fertility at that kind of level, because it will open up all sorts of horrible doors. It will mean that people of any age, if someone aged 70 wanted a baby, you could create stem cells from that. You could create gametes, eggs and sperm from their stem cells, create the embryo, put it into a surrogate mother, and create a baby for 70-year-old people. It's totally unethical, and the regulatory authorities need to stamp on this, because the creation of eggs and sperm from stem cells is pretty imminent. It's been several people have reported the initial experiments on this kind of thing, and we need to be very wary. We need to clamp down on this, because we should not be interfering with the early stages of human life in this way, and we should not be creating babies to parents who may otherwise be incapable of supporting their child in terms of being alive for the child. If you have a baby when you're 70, the chances are you will probably not see their 21st birthday. But that's for the ethicists. It's not for the scientists. It's for the ethicists, and it's for the regulatory authorities. And I'm sure if and when this comes to fruition, the regulatory authorities will just stamp on it completely and say no. But there may be other countries where regulation's low, and it might happen. So we need to think about those things, and these are things that the scientists are working on just now, and they're working on it for scientific reasons. They're not doing it just to be controversial. And it's very interesting if you could get eggs and sperm from stem cells. It's an interesting, scientifically, it's an interesting observation, and I would be interested in that kind of data, but not bringing them together to form a new human life. That's bad. But
What
it's
about
not
the
for me.
drugs? What about the drugs which are being tested on these cells?
Drug screening or drug
Yes,
testing.
drug screening and drug testing,
Yeah,
anything.
yeah. Yeah, so yeah, I mean we've got organoids, which are effectively tiny little organs. The problem with organoids is that they're actually not little organs. And this is something that I think the media have probably invented. What organoids are collections of cells that have been differentiated in a specific way. So that they're little tiny collections of heart cells, for example, or little tiny collections of liver cells, or whatever. So this provides an interesting model for drug screening. And so you could take your drug and you could expose it to the organoid, and you could find out what the reactions were, the biochemistry and everything in the organoid. And that would be great, and it'd be interesting. The trouble is, an organoid is not a kidney inside a human being. It's a little tiny group of cells in a dish, in a laboratory, that's had a drug thrown at it. Now, when we take drugs, I don't want to get into pharmacology too much, but the drug goes into our body and it's taken over across to the liver, and the liver quite often metabolizes that drugs into all sorts of different things. Some of those we don't even understand or know about. So that's the first thing. The putting a drug into a dish with some human cells in is interesting, but it does not reflect in any way what that drug will do in a human. So we could The only thing that you can be absolutely sure of with organoids and this kind of screening and testing is if you put a drug into the culture with the organoid and the organoid either died, so the drug was toxic, so that's it, or the organoid started to or mutated and turned into cancer and in response to the drug. Now, those two would be pretty big alarm bells to that particular drug. And you could perhaps say that's a good reason to exclude this from further studies and look at other things. So that would be, so all of this technology is great for basic science of drug screening, but you cannot jump from organoids to humans. That's too much of a leap and it's potentially dangerous.
Yeah,
Yeah,
I agree with you on that, because there are a lot of false statements which these experiments have actually given. There are
yeah,
drugs which have immense side effects, but
yeah, yeah.
will there be a drug with no side effects tomorrow?
No, never. Every drug has a side effect. We I keep on about the COVID vaccine and they keep on about saying it's 70% or 90% effective, which is absolutely fantastic. But some people react to it. And that's a fact of life. Whenever we inject something or whenever we take a tablet or breathe something in, it has an effect in our body. And that effect may be beneficial. So, for example, take some paracetamol for a headache. You take two paracetamol, and 30 minutes later, your headache's hopefully gone away. And that's brilliant. And that's 1 gram taken, single dose, and that's fantastic. Take an overdose of paracetamol, and it will actively destroy the liver. Patients who take paracetamol overdose are very prone to fatal liver damage. So paracetamol is a toxic chemical, in other words. It's the dose that counts. Thing that we have in the pharmacopoeia, the list of drugs available at the moment, is potentially dangerous. And we need to understand that there's a side effect on everything. There's a side effect on the vaccine, all vaccines. It may just be an ache in your arm after you've had the injection, but that's a side effect. And nothing is risk-free in this world. There's always a risk in everything that we do. If you go out in the car, that's a risk. If you walk across this road in the street, that can be a considerable risk. Especially me crossing the road in India, it's very risky. But so yeah, that's something that once again the public in general have become very risk averse, and they think that we can do things that carries no risk, and that's not the case. The scientists know that, the clinicians know that, and we need to get that message across to the general public that not to frighten them. We don't want to frighten them, but we want them to understand and be realistic about what things can and can't do and what the risks are. So yeah, very good question. Thank you.
Yeah, there are organoid models, as you said, it's probably toxic as an experiment, which
Yes.
is being induced into the mindsets of these drug screeners, drug testers who are actually in this industry. Now,
Yeah.
I just want to just ask you this one question, where scientists have found an high level MYC expression promote proliferation and DNA damage in hemopoietic stem cells and progenitor cells. What is genetics all about to the stem cell researchers today? There are a lot of ways in which genetics also has an influence in this technology. Whether it comes to tissue engineering, yes, there is an influence of genetics to some extent.
Yeah, yeah.
What's that influence of genetics that we have in this regenerative medicine all about?
Yes, it's very important actually. I mean, obviously, induced pluripotent stem cells involves genetics, but the first thing to say is that we have to be sure that the stem cells are genetically normal. Um, and if a stem cell, let's say you want to work on adipose stem cells, so we take adipose tissue, fat from the abdomen, we take it to the laboratory, we process it, we treat it with enzymes, we do all sorts of manipulations and washes and cultures in the laboratory. And that's quite a complex process. And then we come out with some stem cells and we say, right, these stem cells are now ready for treatment. But we need to, and this is important, we need to understand the genetics of those cells. So we need to assess the genetic composition of the cells, and also more importantly, assess the genetic stability of the cells before they're taken to clinical use. So this should be a step that's in all stem cell technology. And most people working on stem cells have this in their mind. And there's lots of scientists working on the basic science on this, but it's very, very important. Another thing on this is that I've mentioned iPS cells, induced pluripotent stem cells. Now, there is a company in Cambridge who I know very well, that they do some great work. And they're doing a variation on stem cell technology where they take a cell from the body, so skin or blood or whatever, and instead of introducing these 4 genes that make an induced pluripotent stem cell, they introduce the transcription factors, i.e., the genes that make the cell, the target cell. So this is a bit complicated, but what I'm saying is you can go straight from, if you used induced pluripotent stem cells, you have to go from your blood cell to your induced pluripotent stem cell and then grow it in the laboratory and do lots and lots more things to it to make it into heart or liver or whatever. Now, with this technology, the company is called Mography in Cambridge. With their technology, they go from the blood cell directly to the cell of interest. So they go directly from a blood cell to, say, a heart cell. And they do that by using amazing technology to introduce the actual transduction factors or genes that actually take a blood cell to being a heart cell. So it takes away the stem cell bit, which is just an added complication in iPSC technology, really. So, this has been published in Nature, which is one of the biggest or the most respected science journals in the world. And the guys there are absolutely astonishing doing this work. And they are in the preclinical phase just now, but it will get to clinical trial fairly soon. We still have the worry about the genetics, and that's why I brought it up in this, because even introducing these transduction factors into a normal cell, taking it from a blood cell to a heart cell or whatever, that is a big genetic change or a big genetic interference with that cell. And so the people know this, of course. And what we need to do is to make sure that the cell that's produced from this type of technology is completely stable from a genetic point of view. The reason for this, of course, is that we don't want to have any treatment that results in some sort of tumor in the recipient patient, because we've put stem cells in that were either unstable or mutated or whatever. And that's something that is very, very important. So clinical genetics has a major role in stem cell technology. In fact, stem cell technology needs input from almost everyone in the clinical field, because it's such a complex proposition to take a cell and to give it to someone to give them some sort of regeneration of tissue. That's such a complicated proposal that it needs the input of absolutely everyone in science and medicine, and also the regulators and the politicians and the media to make it happen safely and properly.
Yeah, yes, sir. There are ways in which scientists have been rejected by some of the publications. When you told about the nature, there are publications where it was never been accepted, even though it was a proper,
Yeah,
dedicated research which actually told what the process was. Do you have any
yeah,
memorable ones of being rejected?
yeah. The scientific publication process is, in my opinion, flawed. We have lots of things that are published that are probably incorrect. We have a system called peer review in science where a manuscript is submitted to a journal and it's sent to some eminent people who the journal hopes can give unbiased feedback on that paper. The problem is that the feedback is not always unbiased. It's not always correct. The reviewers may not even read the paper properly. They may not understand the paper. And so we have to try, and then it's a big problem in science. There have been many papers, even in stem cell technology, there have been many papers that have been withdrawn, that have been previously accepted by the most highly regarded journals in the world. And this is because either the refereeing, the review process was not done properly, or it was done ineffectively, or it was done by people who really didn't understand what they were reading. And also, of course, the other option in these situations is that the data that was actually presented was fake. So it's a big problem in science, and I have no idea how we resolve it, but it's there. And I suppose the first step is just to be aware of it, to realize that when you read a paper in a scientific journal, you've got to read it with a certain level of skepticism and a certain level of criticism. And when we teach this in universities, when I teach in university about assessing publications, I teach the students to be critical, to be analytical, to ask questions, not just to accept what's written. But unfortunately, at the high level of science, especially if it's a very eminent scientist who's written the paper, other scientists do not have that critical mindset when they read the work. They think, this has been published, it's been reviewed, it must be absolutely spot on. So when I read it, I will accept everything that's in there. But that's not right. We need to be more, I think as scientists, we need to be more critical about the way in which we read things, understand things. The debate that we have between ourselves needs to be more open and more honest and truthful. This is not the case at the moment. And of course, we have scientists who work for big companies, not academic scientists. Academic scientists are those based in universities. There are scientists working for big pharmaceutical companies and massive, highly funded companies around the world doing various things. And of course, those scientists have profit in the back of their mind. So when they do their experiments and when they analyze the data, they want that to be in such a way that it will make a product for their company. And they may or may not do this deliberately, but it may be in the back of their mind that they actually focus on things which are probably not very good, but are what the company wants. what the company wants to hear. And so they're being paid a massive salary by the company to do research, to develop products for the company. And so that becomes really quite difficult as well, where the scientific integrity can break down a little bit. So yeah, it's a big problem. I've no idea even how
Any
to begin.
memorable ones that you had?
Sorry?
Any memorable ones that you actually experienced while publishing an article or a journal?
Yeah. I mean, I've refereed hundreds of articles over the years, and it's interesting to note that usually there's 2 or 3 referees on a paper, and I'd be one of those people. So I'd send my report in, and I'd probably say, this is actually not quite good, and it needs more work, and it's not really significant enough to publish. And then the other 2 referees would write in and say, this is absolutely amazing and should be published immediately. And in that situation, if I was, say, one of 3 and the other 2 guys said it was marvelous, then it would be published. And I'm not sure whether that, I think papers, actually, this is a good point, good thought, actually. I think papers should carry the referee's comments, because when the paper's published, these are never seen. We don't see, because and then we'd be able to see that some guys say in one sentence, yes, this is a good paper and I agree it should be published. And that's their reference. Another guy might spend 2 pages describing why he thinks it's good and where he thinks the problems are. And if those referees' reports were published alongside the journal, that would give people a better idea as to how the referees thought about this paper. But it's just not happening. I don't know what the politics of the journals would be on that. But it seems to me that this is critical information. It's almost as important as the paper itself, as the referees' comments on the paper. And we never see them. They're pretty much confidential. If you ask the journal, they say, no, we can't show you that. And it makes you wonder why then. So yeah, it'd be a nice thought, actually, to have referees' comments on manuscripts.
No, sir. There has been this question of how fast is the influence of regenerative medicine after administration, and are there any factors that can be used in order to boost the performance of these stem cells that have been administered? There are a lot of questions which has been answered, but like with reference to this, which is that most influential and the most amazing concept according to you in the regenerative medicine, with reference to the previous thing which I had asked from?
Yeah, no, you're very right. The common concept is that stem cells are injected into a person and they get some sort of miracle cure. This is not the truth in any shape or form. Even if you take bone marrow transplantation as an example, when a bone marrow transplant is carried out, it takes sometimes up to 3 months for the patient to have a new operating bone marrow producing blood cells. And during that time, that patient has to be in isolation because they've got no immune system. They have to receive highly complex medication and treatments. They may develop graft versus host disease, which is commonly known as rejection, and this causes major problems, even death sometimes. So with a bone marrow transplant, the medical follow-up and the rate of recovery, if you like, is very slow. Now, This also applies to most stem cell treatments in regenerative medicine. So if you have a painful knee and you have your adipose or fat stem cells taken out, processed and injected back into your knee in the hope that that will help out. It'll reduce the inflammation and repair the damage. Now, this is a long-term effect. It does not happen. It's not like taking a paracetamol for a headache and the headache going off 30 minutes later. In a stem cell treatment, there needs to be considerable post-treatment support using traditional medicine and traditional procedures. For example, that knee patient, he might need considerable physiotherapy to get the knee working again properly, and that may take months and months and months. So we must not think that a stem cell treatment gives an instant cure, because it doesn't, and it needs that medical backup following treatment. My own research also uses, as well as all the standard traditional medicine, uses compounds called nutraceuticals. And these are developing or newly developing drugs or chemicals, if you like, that actually interact with stem cells and enable them to do what you want them to do. It's a very complex subject. It's not something, I don't think I may have mentioned it in the book, I can't remember, but this concept of supporting stem cells following injection into a patient is absolutely critical. And once again, private clinics doing these treatments have no interest in the post-treatment care of the patient. They will bring them to the clinic, they'll do their injection, they'll take a large amount of money from them, and they'll send them home. And there's no follow-up, there's no post-treatment activity whatsoever. And therefore, even if the treatment might have worked with support, it certainly won't work with no support at all. The most innovative stuff that I know in stem cell technology at the moment, and it sounds a bit pompous, but it's my own research. Scientists often say this. They say that their own research is the most important, and it's often taken with a pinch of salt. But I truly believe that we're onto something with these very small embryonic-like stem cells. These are pluripotent stem cells. Now, I don't want to get into terminology at all, but pluripotent stem cells can in theory make all tissues in the body. So these VSELs can in theory repair all tissues in the body. So we're looking at a stem cell that could repair liver, kidney, brain, anything you like, really. And these stem cells that I'm working on are in our peripheral blood. So they're in the blood that's in our veins. Everyone's got them. We're carrying them around. So you can take these stem cells from a patient's blood, and the process that we use is because the VSELs are thought to be inactive in us. I believe that's wrong. I don't believe that they're inactive. In fact, there's a lot of research going on just now about the possibility of the VSEL being the basis or being the source of the bone marrow stem cell. So instead of the bone marrow stem cell being the ultimate cell for transplant, it's actually coming from, it's being made by VSELs. It's not confirmed yet, but I think it's going to be confirmed pretty soon. Talking to people who are working in this field. So we've got these VSEL cells in our blood. We can take them out. We in my research and in my clinical work, we activate the stem cells with the laser. Now we're still working on the theories about why this works. And then we give the cells back to the patient intravenously. Now, these are called very small embryonic-like stem cells, VSELs, and they are very small. They are about the same size as a platelet, which is about 1 to 4 microns across, which is about 1 to 4 millionths of a millimeter across. So they're absolutely tiny. The reason I say this is because there's a lot of interest in neurodegenerative disease at the moment. And there's a lot of stem cell hype out there. And there's a lot of people promoting intravenous injection of a wide range of stem cells, mesenchymal stem cells and very many others, into the patient to treat the brain. Now, this makes no sense at all, because if you introduce something like a mesenchymal stem cell into the vein, into our circulation, it will shoot around the body and it will land in the lungs, and it will be caught up because of its physical size. It will be caught up in the lungs. It'll be held up. It will never, ever reach the brain. So this is another objection to these people who are offering such treatments for neurodegenerative disease. There's no way that stem cell is ever going to get to the brain. Some of these people will then say, ah, yes, but the trapped stem cell in the lungs will then release exosomes, which are small and could get to the brain, which is possible, but we have no idea what exosomes can do in the brain. So there's no basis for that concept whatsoever. But getting back to my point, the main thing about VSELs is that they are very small and they're pluripotent. And being very small, they do not get caught in the lungs if they're given intravenously. They can very easily cross the blood-brain barrier, which is a biological system that surrounds the brain that stops unwanted things getting in. They can very easily cross that. And once they're in there, they are pluripotent, so they can make nerve cells. Now, this is cutting edge stuff. This is not routine. We've done some clinical studies. We've actually done a clinical study using these cells for end-stage heart failure. So we tried them on 10 patients in a controlled clinical study, which we'll publish very soon, where we used these laser-activated VSELs on heart failure patients. These patients were so ill that they were waiting for a heart transplant. So that's the situation that these guys were in. They received shots of VSELs, laser-activated VSELs, and all 10 patients increased their heart output to the point that they were taken off the transplant list. So we've taken patients who are almost certainly going to die very soon to the point where they are recovering. These patients that we treated are still stable. They still got a good output from the heart. And so this is another thing. I mean, this will be published very soon. We're writing up this one up just now. But this is where stem cells are going to go, I think. We need to use what are scientifically known as autologous stem cells. That means taking the cell from the patient, doing something to it, and giving it back to the patient. All these thoughts about donor cells, very complicated unless you're talking about bone marrow, which is very well established. All the others, very complicated, all sorts of problems. And all these ideas about genes and embryos and all this lot, we're all carrying around the stem cells that we need to repair ourselves. It just needs a little bit of intervention to get them into the right place, in the right condition, in the right time to do their repair. So this is where I think we're going with stem cell technology. We need to focus on autologous stem cells, and we need to look at technologies such as laser activation. We haven't tried laser activation yet on other stem cell types, so we need to do that because it could be that this technology enhances the basic activity of active stem cells as well. But we don't know that yet. So that's really where we are in terms of the cutting edge from my point of view. Other people may think very different because they've got different focus, but that's just where I think. And, you know, over the years, I've worked on all stem cell types. I worked for many, many years on cord blood stem cells, for example. And I've worked on other tissues, liver and so on. So I've really seen most things over the years, and this VSEL stuff really blows my mind. It's something that when I see a patient react to this thing, someone who's on a heart transplant waiting list, and suddenly their heart starts working sufficiently to take them off the list, that to me is absolute heaven. That's what I want from stem cells. I don't want money. I don't want fame. I want to see patients benefit. That's it, really.
You know, there has been a lot of problem statements that we last few questions, sir. Last few questions. I think
Yeah.
last few questions. You know, there has been a lot of problem statements that this field has really seen. The technology has been that influential, but you know, there are technologists who work in this field say you can use this for anti-aging. What is this all false statements that is being made in this
Yeah,
field,
yeah,
and what are all
yeah,
these just proving to the science?
yeah. The anti-aging thing is actually very interesting, and it's got two main sides, really. First of all, there's the cosmetic side. So the cosmetic industry has a considerable amount of things that contain also all sorts of scientific sounding things, and they promote this as anti-aging. It's usually to do with the skin, so you know, anti-wrinkle and all that kind of stuff. And then we've got botulinum toxin injections to cause paralysis, to remove wrinkles and all that kind of stuff. So there's the cosmetic side. It's a billion, probably $1 trillion industry. And there's no real science behind it. It's really just hype, but you know, the cosmetic companies will defend this vigorously. So really, we just have to accept that people are happy to pay large amounts of money for products which may reduce a few wrinkles and make them look slightly younger, but in fact the actual overall effect is zero. Because aging is a natural biological process. Aging is absolutely essential to the future survival of humanity. If we don't age, how will we feed and house all of the people that are living to 100, 200, 300? I don't know. It would just be absolutely ridiculous. And that there are scientists who are working on anti-aging ideas. And of course, stem cells come into that because stem cells are regenerative. And the naive concept is that if you put stem cells into someone, they will somehow magically either revert or stop their aging process. It's pretty ridiculous, really. There's no science behind it. And even if it did work, would we really want people around the planet aged 200 or 300? What would be the psychological impact of that? What would be the social? and the global impact, it would be absolutely enormous. So anti-aging, the other side of this, of course, is that there are pathologies, i.e. diseases, that cause premature aging. And this is extremely distressing for those people who see this. I mean, I've seen cases of a 10-year-old boy, for example, who looks about 60 years old. You know, he's got all the wrinkles, and it's not only the physical appearance, it's the clinical appearance as well. So the organs in the body age rapidly as well. Now, this is a pretty rare syndrome. It's not common, but it does exist. And it would be nice to be able to offer something to these patients to help prevent their premature aging. But whether or not that's possible and whether or not it would involve stem cells, I've no idea at this stage. So that would be a good thing to do. But I think in general terms, the concept of making people live for hundreds of years is just quite bizarre. But there is a lot of stuff out there. The internet and the social media is packed with this kind of stuff. And they really, really want to see people living a long, long time for some reason. I think 70 years and 10 is probably enough for most people. I'm 62 at the moment. I wouldn't want to go much beyond 80, I wouldn't have thought. Which is sort of, you know, we see 80, 90-year-old patients quite commonly now. There are even several patients who are over 100. But I think we need to listen to the biology and not try to interfere with a natural process that is essential. Everyone has to die at some point, and that should be accepted by everyone, I think.
You know, sir, there is been a lot of ways in which stem cell has also seen breakthroughs, and
Yeah,
stem cell or is also still seeing some breakthrough research. But there
yeah,
are
yeah,
some set of challenges which we are facing today.
yeah,
What is the major challenges and the setbacks that this technology has seen today?
yeah,
Why
yeah.
today?
Yeah, I think we've probably covered most of this, but it's really this concept of translational medicine. This means taking stuff from the lab to the clinic, and this is it's not the barrier, but it's the time limiting step of all of these things. So this translational process takes time. And when I say time, I mean, in some cases, it may take years. In some cases, it may take decades to actually come to the point where we are at the position where we can stand up and say, I've got this stem cell treatment, it is tested, it is safe, it is effective, and we can now use it on any patient who is in need. That takes time. And it's this translational process, which involves the clinical trial and all the rest, that is the time limiting step. And it's this time that some people are very impatient about. They want things tomorrow. The general philosophy of people nowadays is that they want things instantly. If they buy a book, they want it straight down the internet and reading it 2 minutes later. Anything like that, it's in the psychology now that things happen quickly, but in clinical science, things happen slowly. The only exception, and I put absolute admiration for this, is the COVID vaccine. In the past, people have talked about equivalent vaccines taking 10 years to develop. And that's been done in less than a year. I don't think that we could, I think we could probably decrease the translation time by making some processes more efficient. And these are not the scientific side or the medical side, but they are the administrative and regulatory side, which can be quite slow and quite time consuming. So perhaps we could reduce time with that. But the thing is, people need to understand that if they want safe, effective stem cell treatments, then they've got to wait for it.
Yes, I just wanted your view, because you have told a lot about how the stem cell technology is influential, how are the setbacks, how the psychology is
Yeah.
impacting the actual setback of this technology is all about. But last question, where will a physician fit in this
The physician.
in this era
Yeah,
of regenerative medicine?
yeah, yeah. Do you know, when I first started work, I was working in IVF, test tube babies, if you like. And in order to do that, we needed a complete team. We need nurses, we need scientists, we need clinicians. And there is no one in that team who is more important than the other. It is an equal level of work and an equal level of responsibility. So the scientists look after the embryos, the nurses look after the patients, and the physicians do all of the medical procedures related to the process. The exact same applies to stem cell technology. In fact, there are some excellent stem cell researchers who are, in fact, physicians. So we've got that overlap already. But in the future, I see the exact same team effort, that hospitals will contain regenerative medicine teams. Those teams will have scientists, nurses, clinicians, and all the support staff that are needed. And they will work as a coherent team to provide the very best treatment and the very safest and most effective treatment to their patients. And in that way, we will have a system that works for everyone. We'll have no heroes. We'll just have effective teams working on a global scale to the benefit of humanity. That's what we need.
Thank you so much, Professor Peter Hollands, for this amazing podcast.
Yeah.
I have never thought whether the regenerative medicine can never be an hype or an hope, but actually, this clarified all my doubts. It's not an
Yeah.
hype, it's not an hope, but it's just for the cure. Thank you so
Yeah.
much for this amazing podcast, and
Okay.
an amazing podcast that can really clarify all the doubts for this general public about the regenerative medicine.
Okay, that's brilliant. Thank you very much. I look forward to seeing it online.
Thank you so much, sir. Thank you so much.
Thank you. Bye for now.
Bye, sir. Bye. Bye.